This last year has been so hard, last year and a half, so hard on all Americans and people all over the world. The burdens of COVID on people's health, on people's well-being, happiness, anxiety, the worries they have about their own health and the health of people they love. But in particular, the effect of the last year and a half on our frontline healthcare workers has been incredibly dramatic. Now, I'm really happy to bring Corey and Jennifer up. They'll tell you more about their sister and about why they are pursuing what they're pursuing, but maybe in particular, which I find really staggering, how they've been able to take this intense sadness in their own lives and turn it into something positive for others.
It was incredible to us after my sister died to learn that burnout, depression, anxiety, and even suicide are well known and actually documented occupational hazards of working in healthcare. People know about it in the healthcare industry, and we had no idea that prior to the pandemic, 400 physicians die each year by suicide, which is twice the rate of the normal population, the general population in the United States. And nurses have an even higher rate of suicide.
The level of burnout, moral distress, and repetitive trauma experienced by our healthcare workforce when we started this is now magnified tenfold. We cannot rely on that same workforce that is taking care of our patients every day to overcome these barriers alone. Jennifer and I and our foundation have stepped into this arena to help, and we need the federal government, the state government, and every healthcare institution in this country to step into the arena with us.
So we're here today to tell you that together with Senator Kaine and a bipartisan, bicameral group, we have gathered industry leaders to develop a bill that will be an immediate and long-term impact on this critical issue that affects all of us in this country and actually in the world. So now it's time for the House to act and show their support, and we need to take a collective stand to show that we are here for our healthcare workers who are here for us.
Here's what the bill would do. It established grants for healthcare professionals or trainees in strategies to deal with mental health, substance use disorders, thoughts of suicide. It requires the identification and dissemination of the best practices for preventing burnout, stress, suicide among all healthcare professionals, including trainees, med students, nursing students, others at the beginning of their career. It establishes a national education and awareness initiative to encourage healthcare providers to seek the help that they need and ensure that they're not burdened or punished if they do so. We establish grants to healthcare entities that have done novel things that seem to be working, so we can have them do more, learn from them, and hopefully scale them up around the country. And finally, the bill promotes a review related to improving the mental health of healthcare professionals and their resiliency, including how the COVID-19 pandemic has affected our healers. Many in the medical profession, and surveys have shown this again and again, are reluctant to seek help or reluctant to tell others they need help because they're worried not about their patients, not about their health, they're worried about their job. If I just acknowledge that I need help, we're not being honest to our statement that we consider healthcare folks heroes if we're not there for them and try to provide avenues so that they can seek healing themselves. Representative Susan Wild of Pennsylvania, is the House sponsor of the LORNABREEN Act and is carrying the version that's passed through the Senate on the House side. And she feels very, very confident that once we're over the hurdle on the reconciliation bill we're working on now, that this has superb chance of passage. We can put it on President Biden's desk. He can sign this legislation in honor of Lorna, and it can do a lot of tremendous good.